Hello, welcome to my channel. My name is Jacqueline Lovett, and I'm a licensed insurance broker with over 10 years' experience in the insurance industry. I help people just like you every single day make the most out of their insurance and maximize their benefits. Insurance can be complicated, but it doesn't have to be. So grab a cup of coffee or tea and let's get into it. All right, so one of the questions that I get the most often from clients is, what is the difference between Medicare and Medicaid? All right, so Medicare is actually through the federal government. You receive it usually when you turn 65. If you have been on disability for at least 2 years, then you can also qualify. Now, you do also have to make sure that you've actually paid into Medicare for at least 10 years, meaning you have to have the correct amount of credits in order to qualify. So if you can find this information out by just calling Social Security, and I'll post that number in the comments below. But I believe it's 1-800-772-1213. You call that number, and you can go ahead and let them know that, hey, I think I have enough credits for Medicare, and they can check in their records to see if you qualify. All right, so you'll usually get that with Part A premium free, and then if you are and then for Part B as in boy, which is your Medicare, Part B premium, which covers your medical, um, that you would pay for on a monthly basis. And in this year, 2025, it's actually $240. Okay. I'm sorry. That's the Part B premium. I mean, Part B deductible. The Part B premium year monthly is $185. So that usually comes right out of your Social Security check. So you may not even notice that it's coming out, but just know that it is. Okay. All right. So as far as and Medicare, you don't have to have like any particular income, or there's no criteria other than you being 65 years of age or older, or have been on disability for at least uh, 2 years. Okay. So now, um, Medicaid. Now, Medicaid is a little bit different because every single state has their own requirements for Medicaid. So I'm in the state of Florida. The rules here are going to be different than the rules in North Carolina. They're going to be different than the rules in New York. It's going to be different than the rules in California. Okay, because every state is going to be different in terms of what their income limits are, in terms of what qualifies you. So but here in Florida, if you are qualified for Medicaid, then what will end up happening is you will receive if you have a higher level of Medicaid, which would be, let's say, full Medicaid, you can have QMB plus, you can have regular QMB only. You can have QI, which is a qualified individual. You can have QDWI. You can have SLMB. You can also have SLMB plus. And these are all based on your income. So every state is going to be different when it comes to that. Um, if you have any specific questions in regards to your uh, situation, you can leave a comment down below, and I can try to see if I can help you get that information. But these are the different levels of Medicaid. So depending on which one you have, will determine how much cost sharing Cost sharing being how much you would have to pay out of pocket for your medical services. So always keep that in mind because um, Medicare can be pretty expensive. There have been a lot of changes with Medicaid this year, and actually over the last 2 years. So you may have heard in the news, or even from friends and family who may have, been on Medicaid, that a lot of people were kicked off of Medicaid. And as in the last couple of years, there have been some changes legislatively that um, retracted some of the money that was out there for COVID. And so now that money has been retracted from the states. And so many of the states have just taken people off of Medicaid, and then you just have to reapply. So um, I would strongly suggest to all my clients, if you did have Medicaid at one point and then you were kicked off, go ahead and reapply because you may be eligible for it and just not know it. They were basically just kind of reshuffling the deck, if you will, for Medicaid for each state. So go ahead and reapply. I highly recommend it. Many of my clients did go ahead and reapply and they were approved. So it's possible that you certainly, can get approved again as well. You just have to go through the necessary channels to do so. So it may take a little bit more time, but just know that, if you are approved, it's definitely worth it in the long run because it'll save you a lot of money. Okay. How to apply for Medicare? Again, you just have to make sure that you call Social Security and apply for it. Now, if you are actually still working, and you plan on working past when you turn 65, you can also let Medicare know that by calling Social Security. You can still get your Part A, but you can what is called delay your Part B. Okay. And just let them know, hey, I'm still working. I'm getting insurance through my job. So I don't need Part B yet. And then when you are ready to go ahead and retire, you can just call Social Security and let them know, hey, I'm going to be retiring in such and such month. I'm going to need my Part B, and they will go ahead and get you set up to have that Part B started. Now, you do have to make sure that you give them the necessary information they need to verify that you, in fact, did have insurance through your job. And then once they're able to verify that information with your job and your employer, then they will be able to go ahead and issue you a Part B effective date. All right. So um, that's how do you apply for it. How you apply for Medicare. How you apply for Medicaid. You have to call your state Medicaid um, program. You can easily Google that number just by putting in the name of your state and Medicaid, and it should come up with. In many states, it can be the Department of Human Services. It could be social services of the state. It could be listed under any one of those things. But the main thing you want to focus on is making sure that it is Medicaid related. So if you're in Ohio, you can say Ohio Medicaid phone number, and it should take you right to the website. Or you can get the phone number as well right there on Google. So just do that, and you'll be able to look at apply for it and see if you can get approved. All right. So good luck with that. It can take some months. Usually the states, unfortunately, take their time getting those applications approved. So just don't be alarmed if it takes a month, 2 months, maybe even 3 months to get approved. They have, everyone else and their mothers probably applying too. So, and with a lot of the staffing shortages, many of the government facilities may not have full staffing. So, Just know that, hey, they're trying to handle as many cases as they can.